Imagine this. Over 850 million people worldwide are living with some form of kidney disease. Yet nearly 90% of them have no idea until it's too late. That's not a random statistic, that's straight from the International Society of Nephrology. And here's the shocking part. If your kidneys fail, you could find yourself chained to a dialysis machine for 4 grueling hours a day, 3 days a week, every single week. Your entire life, your schedule, your freedom, all held hostage by tubes, needles, and crushing fatigue that hits you like a freight train after each session. These tiny organs, each only the size of your fist, silently filter your blood about 60 times every day. They sift through over 200 liters of blood daily just to keep your body clean and balanced. But the moment they falter, toxins build up, poisoning not just your kidneys, but increasing your risk for heart disease, stroke, and in worst cases, total kidney failure. So, can you escape that fate? Maybe. And the answer could be hiding right now in your kitchen. Because in the next few minutes, we're diving into 5 powerful natural drinks that science says can help protect your kidneys and keep them running strong. We'll reveal the active compounds inside them, how to prepare them, and the best ways to enjoy them, all backed by real research and reviewed by medical professionals. Before we get into it, don't forget to like, share, and subscribe to Elderly Health Tips so you never miss life-saving information like this. Let's explore the first juice together, cucumber juice. What if I told you there's a humble green juice almost entirely water that might help protect your kidneys, cool your body, and even lower your risk for kidney stones all at once? First off, cucumbers are about 96% water. That's incredibly important because proper hydration is one of the strongest defenses we have against kidney disease. According to the National Kidney Foundation, even mild dehydration can cause waste products to concentrate in your blood, making your kidneys work harder. And in older adults, thirst perception declines, which means seniors often drink less water without even realizing it. One large study from the American Journal of Clinical Nutrition showed that people aged 65 and older who stay well hydrated have a nearly 60% lower risk of developing severe kidney problems compared to those who chronically underdrink. And dehydration doesn't just hurt your kidneys. It's linked to higher rates of urinary tract infections, constipation, confusion, and even increased falls among seniors, as reported in the journals of gerontology. Now, let's talk about kidney stones. Data from the National Institute of Diabetes and Digestive and Kidney Diseases indicates that about 1 in 10 Americans will have a kidney stone during their lifetime, and older adults are not immune. Drinking fluids like cucumber juice can help dilute minerals in urine, reducing the risk of stones forming. Cucumber also contains compounds called cucurbitacins, which have mild anti-inflammatory properties. A 2021 paper in Phytotherapy Research highlighted that cucurbitacins might help lower oxidative stress and inflammation, both of which are contributors to kidney disease progression. I've got a patient, Mr. Jenkins, he's 70, a retired mechanic from Ohio who suffered recurring kidney stones. He started drinking cucumber juice blended with a bit of lemon and mint a few times a week. Not only did he find it refreshing, but his stone episodes became far less frequent. Now, of course, that's just one example, but it matches what the research shows. Hydration and certain natural compounds can make a real difference. Another great advantage for people with kidney issues. Cucumber juice is naturally low in potassium, sodium, and phosphorus. Why does that matter? Patients on dialysis or with chronic kidney disease often need to restrict these minerals because high levels can be dangerous, causing heart rhythm issues, bone problems, or further kidney damage. According to the National Kidney Foundation, people with end-stage kidney disease are advised to keep potassium below about 2,000 milligrams per day. Cucumbers fit beautifully into that plan because 1 cup of sliced cucumber has only about 150 milligrams of potassium. Let me give you a quick how-to. If your cucumbers are organic, keep the peel, that's where much of the fiber and antioxidants are. Toss them in a blender with some cold water. For extra flavor, add lemon juice, green apple slices, or fresh mint. Strain it if you like a smoother drink, or keep the pulp for added fiber. A few words of caution. If you suddenly notice swelling in your ankles or legs, darker urine, or feel overwhelmingly fatigued, don't ignore it. Those can be early signs that your kidneys are struggling. Always talk to your doctor if you see those changes. Now, let's move on to juice number 2, pineapple juice. Did you know there's a sweet tropical juice that's not only delicious, but could help fight pain, lower inflammation, and even support your heart, all while staying safe for folks with kidney issues? I've been practicing medicine for over 35 years, focusing on kidney health and geriatric care, and if there's one thing I've learned, it's this. Sometimes the simplest natural foods can be powerful medicine. Pineapple juice is one of those hidden gems. Pineapple juice contains a natural enzyme called bromelain and has gotten a lot of attention in medical research over the past couple of decades. According to a 2016 review in Biomedical Reports, bromelain has significant anti-inflammatory and pain-relieving properties. It helps reduce levels of prostaglandins, the compounds in your body that trigger pain and swelling. That's crucial for seniors dealing with arthritis, muscle aches, or chronic joint pain. For instance, the Journal of Ethnopharmacology published findings that bromelain can be as effective as some NSAIDs like ibuprofen for mild osteoarthritis pain, but with fewer gastrointestinal side effects. And let's face it, a lot of older adults can't tolerate high doses of NSAIDs because of risks to the stomach lining, kidneys, and blood pressure. Pineapple juice offers a gentler alternative. But that's not all. Bromelain has also been studied for cardiovascular benefits. Research in phytotherapy. Research suggests bromelain may help reduce platelet aggregation, that's medical talk for preventing blood clots. And while that's helpful in lowering heart attack or stroke risk, it's also a reason to be cautious if you're on blood thinners like warfarin. More on that in a moment. Another big plus for seniors. Bromelain has shown immune modulating effects, meaning it may help regulate the immune system, not overactive, not underactive. A review in evidence-based complementary and alternative medicine in 2012 highlighted bromelain's potential in reducing nasal swelling and sinus symptoms, which can be bothersome in older adults, especially during allergy season. Now, let's talk kidneys. Many fruits and fruit juices are packed with potassium, and while potassium is healthy in the right amounts, it can become dangerous for people with chronic kidney disease. High potassium levels, called hyperkalemia, can cause irregular heartbeats or even sudden cardiac arrest. Here's where pineapple juice stands out. It's relatively low in potassium. According to the U.S. Department of Agriculture National Nutrient Database, 1 cup of pineapple juice has around 180 milligrams of potassium, whereas orange juice can have over 470 milligrams per cup. That's why pineapple juice is often recommended as a safer choice for people with kidney issues, as long as they're drinking it in moderation. Speaking of digestion, pineapple juice can be helpful there too. Bromelain assists in breaking down proteins, improving digestion for folks who sometimes feel bloated or uncomfortable after meals. The National Institutes of Health notes bromelain's role as a digestive aid, especially for older adults whose natural digestive enzymes might be lower than when they were younger. Now let me show you how to prepare it safely. Use fresh pineapple, cut it up, toss it in the blender, add a little cold water, and blend. Strain it if you want it smoother. Many folks enjoy adding ginger for even more anti-inflammatory benefits, or mint for a refreshing twist. But here's my caution. Bromelain can thin your blood. The Alternative Medicine Review and Journal of Medicinal Food both warn that bromelain may increase the effects of blood thinners. So if you're taking medications like warfarin, aspirin, or clopidogrel, talk to your doctor before drinking pineapple juice regularly. Juice number 3, celery juice. Let's start with blood pressure. Celery contains unique compounds called phthalides. These help relax the muscles in your artery walls and let blood flow more easily. A study published in the Journal of Medicinal Food back in 2013 found that people who consumed celery seed extract daily saw an average reduction in systolic blood pressure of around 7 to 8 millimeters Hg. That might not sound huge, but the American Heart Association says even a 5 millimeters drop in systolic pressure can reduce the risk of stroke by about 14% and heart disease by about 9%. For seniors, those numbers are life-changing. Celery contains compounds like butylphthalide, which has been shown to help reduce levels of LDL That's the bad cholesterol that clogs your arteries. The National Institutes of Health notes that in animal studies, celery extract lowered blood lipid levels significantly, suggesting potential heart protective effects. Of course, human data is still catching up, but adding celery to your diet certainly doesn't hurt, especially if you're looking for natural ways to manage cholesterol alongside your prescribed treatments. But what really excites me as a kidney doctor is celery's role in protecting kidney health. Celery juice is rich in apigenin, a natural flavonoid with powerful anti-inflammatory and antioxidant properties. Research published in Frontiers in Pharmacology in 2019 found that apigenin helps protect kidney cells against damage from oxidative stress, which is a fancy way of saying it shields your kidneys from harm caused by high blood, sugar, toxins, and chronic inflammation. And as we get older, our kidneys become more vulnerable to these threats. I have a patient, Mr. Logan, he's 72, retired firefighter from Chicago who's been managing stage 2 chronic kidney disease. He loves his food but struggled with high blood pressure and borderline high cholesterol. We talked about lifestyle tweaks, and he started drinking celery juice a few times a week, blended with green apple and a squeeze of lemon. Over about 4 months, his blood pressure dropped from 145/88 down to around 132/88, and his LDL cholesterol fell by 12 points. Now, he's still on medication, but he feels like he's more in control, and he says the juice helps him feel lighter and less bloated too. Let's not forget hydration. Celery juice is about 95% water. For older adults, that's a big deal, because as we age, our sense of thirst declines. The National Council on Aging reports that dehydration is one of the top 10 reasons older adults land in the emergency room, often with fatigue, confusion, or even kidney injury. A glass of celery juice can help keep fluid intake up, especially for those who find plain water boring. However, here's where we have to be careful. Celery is high in vitamin K, which is essential for blood clotting. If you're taking blood thinners like warfarin or newer anticoagulants, you absolutely need to talk to your doctor before loading up on celery juice. A review in the American Journal of Clinical Nutrition shows that big swings in vitamin K intake can interfere with INR levels, the numbers we use to measure how long it takes your blood to clot. Too much vitamin K can lower your INR, making your blood clot faster, which raises the risk of stroke or clots. Watch for signs like unexplained bruising, bleeding gums, or dark stools. These can signal your blood is too thin or your clotting levels are off. If you see anything unusual, don't wait, get checked right away. Now, for the fun part, how to make it. Grab fresh celery stalks, wash them thoroughly to remove pesticides, chop them up, and blend with cold water. Strain it if you prefer it smooth. Many people love adding ginger for its extra anti-inflammatory kick, or green apple for a touch of sweetness. Lemon juice can help cut the slightly bitter edge of celery. 1 cup of celery juice has only around 40 calories and about 80 milligrams of sodium if you don't add salt much lower than a lot of store-bought juices. Plus, it's full of vitamins like vitamin C and folate, which support immune health, and fiber if you keep the pulp. Juice number 4 is one that's very familiar to us all, lemon juice. What if I told you that one of the simplest drinks you could make, just water and a bit of lemon, might actually lower your risk of painful kidney stones, improve your digestion, help keep your bowels regular, and even give your body a natural detox boost? Let's start with kidney stones. Lemons are one of the richest natural sources of citric acid. Citric acid binds to calcium in urine, which helps prevent calcium from forming crystals, the building blocks of kidney stones. A study published in Kidney International followed 203 patients who previously suffered kidney stones. Those who regularly drank lemon juice mixed with water had a nearly 50% lower rate of stone recurrence than those who didn't. That's huge, because kidney stones aren't just painful, they're also a major cause of ER visits, especially among older adults. The National Kidney Foundation estimates that about 1 in 10 Americans will have a kidney stone at some point in their lives, and the risk increases with age. But that's not all. Lemons also contain hydroxycitrate, a compound shown in lab studies including research in urology to inhibit crystal formation, helping reduce the chance of stones getting larger or sticking together. Though human trials are still ongoing for hydroxycitrate supplements, fresh lemon juice offers a natural way to introduce this protective compound into your diet. Now, let's talk digestion. Lemon juice can gently stimulate stomach acid production. As we age, the stomach sometimes makes less acid, a condition called hypochlorhydria, leading to bloating, indigestion, or poor absorption of certain nutrients. According to the American Journal of Clinical Nutrition, low stomach acid affects up to 20 to 30% of people over age 65. A mild dose of lemon water can sometimes help ease mild indigestion and promote smoother digestion. Lemon juice also brings a natural detox effect. It's loaded with vitamin C, about 30 to 40 milligrams per lemon, based on USDA data, which acts as an antioxidant, helping neutralize free radicals and support immune health. Antioxidants are critical for seniors because oxidative stress is linked to diseases ranging from cardiovascular issues to cognitive decline, as highlighted in free radical biology and medicine. However, there are precautions. Lemon juice is highly acidic. Over time, it can erode tooth enamel if you're sipping it often. The American Dental Association warns that acidic drinks are among the top causes of enamel erosion, which can lead to tooth sensitivity and cavities. That's why I always tell my patients, use a straw to keep the acid away from your teeth, and rinse your mouth with plain water afterward. Another caution, avoid bottled lemon juice when possible. A study published in Food Chemistry showed that bottled lemon juices often contain lower levels of vitamin C and significantly fewer active phytonutrients compared to fresh squeezed lemons. Plus, some brands add preservatives or sugars that older adults might want to avoid, especially if they're watching blood sugar levels. My quick tip, drink lemon water first thing in the morning on an empty stomach. It can help kickstart digestion and refresh you for the day. For most people, half a lemon squeezed into a cup of warm water is plenty, and some folks love adding a bit of honey or ginger for extra flavor and benefits. Of course, lemon juice isn't for everyone. People with acid reflux, GERD, or sensitive stomachs should be careful citrus might aggravate symptoms. Watch for burning in the chest, sour taste in your mouth, or tooth sensitivity. If you notice these, it might be a sign to cut back. Juice number 5, blueberry juice. Let's start with urinary tract infections, or UTIs, because they're a huge issue for seniors. Cranberries contain natural compounds like proanthocyanidins, PAX, salicylic acid, and quinic acid. These compounds help prevent bacteria, especially E. coli, from sticking to the lining of the urinary tract. Without that sticky connection, bacteria get flushed out rather than causing an infection. A 2017 meta-analysis in the Journal of Urology looked at 24 randomized controlled trials involving over 400 participants and found that regular consumption of cranberry products reduced the risk of recurrent UTIs by about 26%. That's significant because, as the National Institute on Aging points out, Utah is account for nearly 10% of all hospitalizations in older adults. And in seniors, Utah can lead to dangerous complications like kidney infections, delirium, and even sepsis. Now about inflammation. Cranberries are high in proanthocyanidins and other polyphenols, which have potent antioxidant and anti-inflammatory properties. A 2021 study in Nutrients found that cranberry juice reduced levels of C-reactive protein, CRP, a key marker of inflammation, by about 2.3 milligrams, L in people with mild chronic inflammation. For older adults, keeping inflammation down matters, because chronic low-grade inflammation has been linked to heart disease, arthritis, and cognitive decline. Let's talk about the heart next. Cranberry juice might help with blood pressure. A study published in the American Journal of Clinical Nutrition found that drinking 16 ounces of low-calorie cranberry juice daily for 8 weeks reduced systolic blood pressure by about 3 millimeters G. That might not seem huge, but as the American Heart Association says, even a 2 millimeter G drop in systolic pressure can lower the risk of stroke by about 10%. And High blood pressure is a major silent cause of kidney damage as well, making this doubly important for seniors. But, and this is important, cranberry juice isn't risk-free. One thing people don't always realize is that cranberry juice can help prevent certain stones like brush-eye kidney stones, but for people prone to calcium, oxalate, or uric acid stones, it might actually increase the risk. That's because cranberries contain oxalates, and higher oxalate levels in urine can promote those types of stones. According to the National Kidney Foundation, about 80% of all kidney stones are calcium oxalate stones. That's why moderation is key. Most guidelines suggest keeping cranberry juice intake to about 4 to 8 ounces per day, roughly 120 to 240 milliliters. Another thing to watch for is sugar content. Many commercial cranberry drinks are labeled cranberry cocktail and are loaded with added sugars, sometimes as much as 30 grams of sugar per serving. That's more than half the recommended daily limit for added sugars in older adults, according to the American Heart Association. Excess sugar isn't just bad for diabetes risk, it also contributes to inflammation, obesity, and even cognitive decline in seniors. So, my rule is always choose 100% pure, unsweetened cranberry juice. And here's a big caution. Cranberry juice can interact with blood thinners like warfarin. Studies in clinical pharmacology and therapeutics have shown that cranberry juice may increase warfarin's effects, raising the risk of bleeding. So if you're on blood thinners, talk to your doctor before adding cranberry juice to your daily routine. Be alert for warning signs like unusual bruising, bleeding gums, or dark stools. Those are red flags that need medical attention. My tip: if the tartness is too strong, mix cranberry juice with other lower oxalate juices like apple or pear. And always keep your portions moderate unless your doctor tells you otherwise. So there you have it, folks, from the cooling hydration of cucumber juice, to the anti-inflammatory power of pineapple, the kidney protecting benefits of celery, the stone fighting magic of lemon water, and the infection blocking force of cranberry juice. These are simple drinks, but they can pack a powerful punch for your kidneys, your heart, your digestion, and your overall well-being, especially as we get older. Remember, small daily choices add up to big health victories over time. Talk to your doctor about which juices might fit your personal health needs, and don't be afraid to try something new for the sake of your health. And hey, if you found these tips helpful, please like, share, and subscribe to Elderly Health Tips so you never miss practical advice that could make your golden years truly shine.